India has reached a stage in the pandemic where it can dare to ask, are we past the peak? Fewer new cases, fewer deaths, higher recoveries, a steady testing rate, but we still have not beaten COVID-19. I'm Pallavi Prasad, and here's what you need to know about the race to a COVID-19 vaccine. About 40 vaccine candidates are now in some stage of clinical trials. 10 of them are in phase 3 trials, which are the late stage clinical trials. Here are the ones that you need to know about. All the caveats that come with vaccines and trying them apply. First, Oxford University and AstraZeneca's vaccine candidate. It's the first international vaccine holding combined final stage trials in India. The results of the trial may be available by the end of 2020, according to our health minister. It means that the first doses under the name COVID Shield could be rolled out in January 2021. This is because Serum Institute of India in Pune is already producing the vaccine just in case all trials end safely to save time. It's a smart move because latest reports suggests that trial participants inoculated with this candidate vaccine at Chandigarh's Postgraduate Institute of Medical Education and Research have reported no adverse side effects and are being prepped for further dosing. A report from the UK also backs this up. The vaccine is in final stage trials there as well, and government officials hope to give it all clearances by Christmas, followed by a 6-month rollout. In the US though, Oxford University's trials are still paused after a volunteer fell sick. Second, India's homegrown vaccine, Covaxin, is in the middle of phase 2 testing. Bharat Biotech has applied for regulatory licensing to start phase 3 trials, but has faced a minor hiccup. It has been told to wait for phase 2 data, study it, and clear some additional questions before proceeding. The third vaccine candidate that I want to talk about is US biotech giants Moderna's. Phase 3 trials are going strong, with safety data expected to come out in the next couple of weeks, after which Moderna will seek emergency approval. Again, production is on parallelly and delivery can be expected in the first half of 2021. Many countries have already reserved millions of doses. Now, Moderna's candidate is not being tested in India yet, but there are 2 reasons to keep an eye out. First, it has an edge over other vaccines because in phase 1 trials, the vaccines worked especially well in people above 65, the most vulnerable group. And second, Moderna will not be patenting their make. This means if found safe, Indian companies can use similar tech to make the vaccine here, test and distribute it. US pharma giant Johnson & Johnson are also busy with late-stage trials of another vaccine candidate, but recently all trials were paused effective immediately after a volunteer fell sick. This is usual. Johnson & Johnson have paused to review all safety data before proceeding. If they proceed and all goes well, according to plan, then Hyderabad-based Biological E will bring the vaccine to India. There are 4 more vaccine candidates that will be available for India if they work. First, Serum Institute of India is planning to hold trials for a vaccine by US pharma Novavax. Then indigenously, Bharat Biotech is also working on a nasal vaccine. Now, it's still early days, but if found successful, this will greatly reduce the burden of inoculating India, since nasal vaccines are easier and cheaper to produce and administer. Then Ahmedabad-based Zydus Cadila is holding phase 2 trials for another indigenous vaccine candidate, and at the same time is ramping up production to roll out emergency doses just in case. And fourth, Dr. Reddy's labs will bring Russia's Sputnik 5 to India. Here's a big red line. Russia has not made available much data on safety and effectiveness of the vaccine. In fact, back in Russia, rumor has it that another vaccine fashioned by the Siberian Vector Institute will soon be ready for launch. Again, we don't know much about it. 3 Chinese vaccines are also reportedly already in use without having completed phase 3 trials. Now I'll stop here with one note. Once a vaccine is ready, after all the regulatory approvals are in place, we still need a financial, a logistical, and an administrative plan to distribute them efficiently and equitably. Thank you for listening to me today. Stay safe.